Hi everybody, welcome to Healthline. I am Gregory Zarian, and the entire show is all about stroke and the conversation of stroke. But I have a few questions. How are you? How is your spring? Are you getting out in the air? Are you doing cardiovascular workouts or exercise at least 150 minutes a week? Are you replacing your sodas for water? And are you shopping more on the outside at the market because that's where most of the healthy food is? And are you eating more green than you are colored foods? Just some healthy tips that we've offered you here at Healthline. So spring, we're going into summer. Hope you're getting your health on. Hashtag health on. Okay, so it's May, and May is Stroke Prevention Awareness Month. Did you know that almost 800,000 people have a stroke every year? That is about one every 4 seconds, and every 4 minutes someone dies from stroke. Those are staggering statistics, and they are fact. And did you also know that stroke is the third leading cause of death here in the United States? To share with us why these numbers are so high and what to do if you have any symptoms or signs, and how to get your life in order so you can be preventative of suffering from stroke, we have two doctors from Glendale Adventist Medical Center. First, Dr. Lance Lee, he's a neurologist, and Dr. Yasser Bader, he is a neurosurgeon. Gentlemen, it is a pleasure. Thank you for being here.
It's a pleasure.
Thank you for inviting us.
We've been to this party a few times, Dr. Lee.
That's correct.
Has stroke changed at all in the past couple of years?
Well, there has been some changes, actually. I know you quoted third leading cause of death. That is now untrue. It is now a fifth leading cause of death.
Okay. Well, you know what? I love when I get corrected in health.
So yeah, there has been movement of using TPA since mid-90s, which really changed the way we practice how we treat the patient of the stroke. And that certainly saved their lives, and now we are seeing the result.
I love that. And Dr. Bader, we're going to talk to you in 1 second. So, first of all, I love the fact that from 3 to 5, that means there's more science and more evolution in regards to how doctors are treating stroke patients. And also, I really want to believe that it's you and the community getting your health on. When we come back, we're going to talk to Dr. Bader, we're going to talk to Dr. Lance Lee, and we're going to share with you the two types of stroke. We're going to share with you more statistics, and we're going to share with you type of procedures that happen at Glendale Adventist Medical Center in case you or someone you love is suffering from stroke. As I always invite you to do, get up, get a glass of water, stretch, maybe even grab a carrot stick. More from Stroke and Healthline when we come back. Do not go away. Welcome back to Healthline. The entire conversation is all about stroke prevention, and it's May, so that means it's Stroke Awareness Month. Joining us are two rock star doctors from Glendale Adventist Medical Center, neurologist Dr. Lance Lee and neurosurgeon Dr. Yasser Bader. Dr. Bader, before the show, you and I were actually talking about where stroke is in regards to deaths in the country.
Yes.
And Dr. Lee said that it has dropped to third. In regards to what you do in neurosurgery, do you have anything to contribute to that?
I think the contribution not only from the neurosurgeon, but it's the team as a whole. And when I mean the team, I'm talking about the public, the emergency room, the awareness from the nurses when the patient comes to the hospital, and the neurologist as a neurosurgeon working as a team. I think that's the change that had impacted the number of patients and the way we treat and we look at a stroke.
That's fantastic. Now, in the very beginning, I said that there's two types of strokes. Dr. Lee, can you share with us what those are?
Well, the most common type of stroke that we see is a so-called ischemic stroke. It's a dry stroke. There's no bleeding. It's a form of a blood clot traveling to the brain, for example, causing the damage to the brain. And the other stroke type would be bleeding type of stroke, which is about 15% of
And that's called a hemorrhagic,
correct.
Right? I want to back up a little bit. When you say non-bleeding, what does that mean?
So,
with the ischemic?
Well, ischemic stroke means when there is a lack of oxygen going
Okay.
into the brain. So that would be the how the mechanism is, and it can damage the brain because brain uses oxygen constantly and probably use the most in your body. So when you stop the supply of the oxygen, then you get a damage.
And but isn't it true about stroke, time loss is brain loss? In regards to Do you treat any of these types of stroke, Dr. Bader? Are you involved in the treatment of ischemic and hemorrhagic, or is yours a lot more detailed because you're a neurosurgeon?
I think the neurosurgery adds another perspective to the treatment of ischemic stroke in the way that we add more value by more instruments and new ways of treating that and a faster way of treating that that was not available in the past.
So before we dive into treatment, I know you also said doctor, because we've talked about this quite a bit on Healthline, is the TPA treatments and stuff like that. Let's break it down. Somebody's sitting at home and they're not feeling well, and they think that they are suffering from stroke. And I know there's a great thing, it's called FAST. Can you help us break down what the word FAST means?
Well, FAST stands for you have to look at the patient's face.
Okay,
whether
so
there's any,
it's not
Right.
going to happen, so I'm John Smith.
Right.
So in regards to my face, what would my face be looking like right now if I was suffering from a stroke?
many times you will see asymmetry of the face. One side would be droopy, it's lowered.
Okay. Can you guys get, okay, so this side, one side would be droopy, so this side would be lower, or that side. So it's kind of like Bell's palsy. if
Correct,
anything.
but Bell's palsy more pronounced, kind of a weakness all over the upper and the lower part. But in the stroke, usually the lower part of the face would be droopy and weak.
Okay, droopy and weak, and then, so that's F.
So
Then A would
A
be-
is an arm.
Okay.
It stands for arm, and you have to ask the patient to lift the arm, see whether the arm gets lazy, and also we call it pronator drift, but looking for any kind of a weakness in the one arm.
Okay, so Dr. Lee, that's, so droopy of the face, A, arms. Dr. Bader, S.
S is the speech.
Okay.
So if you have troubles with the speech, if you notice your friend or relative started having some problems, that's the time to act.
So in regards to speech, normally if I say, hi, welcome to Healthline, I'm Gregory Zarin, but if speech would be a little more garbled, more slurred. And then Dr. Lee, T would be for?
Time. So you have to think about the time, because time is the brain, so you don't want to waste any time. So you have to call 911 right away.
Face, arms, speech, and time. And I'm going to reiterate, time loss is brain loss. If you are by yourself, call 911 immediately. Family and friends, if you have somebody with you, have them do it. Do not drive yourself to the hospital or the
Right.
emergency room.
It is not
Just
recommended that
at all.
your family brings in, because you're going to waste a lot of time. In fact, the ambulance will communicate with the emergency room while you're being transported, so they can already sometimes prepare for you. So ER is aware of the patient coming in, and they could be more prepared.
And that's more of a specialty thing too, because if the ambulance says, okay, we have a stroke patient coming in,
That is correct.
you guys set up a triage, don't you?
Yes. So the treatment would start at home instead of starting when the patient arrives to the emergency room.
So what does that mean, treatment when started at home?
The time, saving the time. Like you said, the brain is time. The more time that we save, the more that we can help have a better outcome and help save the stroke patient.
And since we have not talked about what would be a great amount of time, that's kind of like a Healthline cliffhanger. Okay, so we have shared with you what FAST means. I'll share it with you again at the very end of this episode. And we're hanging on to this cliffhanger. Again, take a few deep breaths, do some stretching. Don't go away. More on stroke and what to do and what to know and how to keep your health on when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarin, and the entire conversation is all about stroke. Now, I left you with that cliffhanger in regards to how much time from when you or someone you love is suffering from what you may think is a stroke. We went through FAST, facial expressions, arms, S for speech, and T for time. Dr. Lee, what is, give me amounts of time in regards to stroke and it being okay and you not having any repercussions to it not being okay.
Well, the brain cells are very vulnerable to this injury, and every minute you're going to lose millions of cells.
Okay.
So the best thing to do is get the patient to the hospital as soon as possible. Don't waste any time there, and let the hospital and the ER ambulance know what's going on. So that is the best thing to do. So just get there in the emergency room as soon as possible, not wasting any brain loss.
And
Please.
if you have a suspicion that you might be having a stroke or your friend is having a stroke, that's enough reason to call. That's enough reason to come to the emergency room and not doubt yourself. We can do that doubt in the emergency room and find out if you actually have a stroke or not, but time is of real importance.
Back to time loss is brain loss. What causes stroke, Dr. Lee?
Well, stroke can be caused by many different things, and it's not something that you can treat overnight or prevent it overnight. Stroke can be prevented by taking care of your overall health. So, for example, heart disease is a main source of your stroke. Diabetes is well known to be a source of stroke. Hypertension, high cholesterol, smoking, lack of exercise, obesity. I can go on and go on and on. And I'm sure many of you already know what the healthy lifestyle is. And in fact, that is a way to prevent the stroke. So you really cannot prevent the stroke overnight. So I want you to remember that it is your daily lifestyle that really prevents the stroke.
A lot of people, thank you, a lot of people who suffer from stroke or maybe a heart attack or any type of malady will think, I can't believe this happened, and they smoke 2 packs of cigarettes a day. Their body mass index is over the required amount for who they are. They're obese, they don't work out. How do you tell patients to get healthy? So just say somebody suffers from a stroke, and your suggestion is, and requirement is, to get healthy. So doctor, how do you invite someone to become healthy?
I think if you had a stroke, that's a warning sign. That's the time to change your lifestyle. That's the time to throw all this garbage in your life and just have a new, fresh start to become a stroke-free person.
Because it happens, every 4 seconds in this country. So someone suffers from a stroke. Ambulance comes and picks them up. They are then transported to Glendale Adventist Medical Center, certified stroke center in the county. What happens, Dr. Lee?
So the patient arrives in the emergency room, then emergency room doctor will call so-called a code stroke. We call stroke alert as well. And then patient will be assessed based on the history, and then they go through the laboratory testing, rule out other conditions, CT scan of the brain to rule out acute bleeding or other issues, because there are other stroke mimicries too. So
Such as?
seizure can be the one.
I love that you said that.
People can come in with a brain tumor not knowing for years, and one day it can just act as a seizure, for example.
Okay.
And they can be very confused, cannot speak. So it could be many different manifestations of symptoms. So the ER doctor's role is to make sure that there is no other possible source of stroke. So once you rule those out, then it becomes a stroke. Then we have a treatment plan for those patients.
So talk to us about somebody getting TPA, Dr. Lee.
So TPA is a clot buster. It is a tissue plasminogen activator. That's
Okay.
an abbreviation for that. It is like a liquid Drano. If you're using it at home, if people will appreciate what that is. So you would give them medicine to dissolve the clot, literally. So TPA would dissolve the clot in case of dry ischemic stroke, and it'll just resolve the stroke symptoms potentially.
So it is just for the ischemic. You can't use it on
That's
the
correct.
hemorrhagic.
So that's the reason why we did a CT scan to make
Okay.
sure there's no bleeding type of stroke. And bleeding type stroke has different, of course, treatment plan for those. So TPA can be given for the folks with a dry ischemic stroke, and the outcome is obviously much favorable if you have given the TPA.
But what happens if the TPA doesn't work?
If the TPA cannot be given, which for several reasons,
Not be given.
So the next step would be to intervene with surgery. And
Okay.
surgery including, just like the same analogy that Dr. Lee was using a Drano, now we can use wires and catheters to go inside the blood vessels of the brain and remove the blood clot. And this would be the next step if TPA cannot be given, to remove the stroke.
But if, just say you go in to remove a blood clot with wires and scopes, will somebody come out of this unscathed? Will there be permanent damage? Or even with TPA, will someone survive this and be like, okay, I had a stroke and nothing happened?
That's a very good question. So the result of the TPA or this type of intervention, surgical intervention, could be highly, of course, variable. And the results could be very, very outstanding versus very devastating as well. But the overall outcome with a TPA and with the intervention, if the patient was chosen carefully, then it could be very beneficial.
Okay, so once again, time loss is brain loss. And one thing I want to add before we go to our next break is in your wallet or in your purse or anywhere in your home that is accessible, please make sure that you have your name, your phone number, your information, and all the medications you are taking for when you are taken to the hospital via family, friend, or ambulance. The hospital needs to know everything that is going on with you in your body, medical history, and everything, so they know what to do when they pull right in. Do not go away. Final thoughts on what to do if you or someone you love is suffering from stroke, and also how to pass on some information and pay it forward. Don't go away. Welcome back to Healthline. The entire conversation has been about stroke prevention and awareness. And I'm going to share with you just a couple more statistics so that may raise your awareness to pay more attention. Stroke rates are higher for African Americans than for whites, even at younger ages. And I'm going to ask the doctors why. Strokes can occur at any age, and nearly 1/4 of strokes occur in people under the age of 65. Joining me is Dr. Lance Lee, neurologist, and Dr. Yasser Bader, neurosurgeon from Glendale Adventist Medical Center. Doctors, why does it happen to African Americans more than white?
Well, I guess it has to do with
Population.
their population's general health.
Okay.
It is true, there's a genetic factors, and we all know that certain parts of our country do not have a good healthcare resource, for example. And also there are different population groups that are not as healthy in terms of their diet. There's different cultures, of course. So there have been studies of certain ethnicity, including Asians and Caucasians and African Americans, having different presentation.
And also a lot of that has to do with culture and the way you eat and your lack of exercise.
Right.
Are strokes hereditary?
A very small percentage can be to hereditary factors,
Okay.
like the way your blood vessels are made, the way your body is reacting to all this diet, or the way your lifestyle is different from one person to the other.
So Glendale Adventist Medical Center is a certified stroke center. What does Glendale Adventist offer that other hospitals don't in regards to strokes then? Dr. Lee?
So the stroke center means that the hospital is ready for the stroke patients when it happens. As you alluded earlier, the time is the most important thing here. So the hospital and doctors have to be prepared to treat the patient as soon as possible. So stroke center means that they are ready. They're ready to go when a stroke patient hits the ER. They don't waste a single minute, and they go to the treatment right away.
So in regards to if John Smith is having a stroke, he knows to go to Glendale Adventist Medical Center over this hospital just because you're certified and ready.
That's correct. In fact, the county has a system to deliver the patient to the stroke center as a rule. So it's been working that way for the last 7-8 years. So county ambulance system is delivering the patient to the right stroke center. If there is your closest stroke center, that's the place to go.
We talked earlier about the ischemic stroke. Dr. Bader, tell us more about the hemorrhagic stroke and treatment.
Hemorrhagic stroke, the difference is that the artery is not blocked.
Okay.
But on the other hand, the artery has a break into it, and that can cause bleeding or blood that happens in the brain. The similarity that it gives the same symptoms or the same fast, if you can say, in the way the patient presents to the hospital. And the differentiation happens when the patient arrives to the emergency room and we image their head and we find if we have a hemorrhage versus we actually have one of the arteries that are blocked.
If there's a hemorrhage, what is treatment for that? That you go in and you cut the vessel from bleeding?
Not necessarily. Not necessarily, but just in this point, we do not use the TPA, we do not use the wires, we do not use the catheters.
It's a lot more extensive.
Yes.
Do you find that, from your experience, more men or more women in regards to stroke? Who suffers from it more, or is it pretty much an equal playing field?
Probably equal number, although the ladies live longer nowadays.
Whoa. Why do you
well,
think
with
that is?
obvious reasons. Their men are more adventurous. They probably don't take care of their health as well. So the women have longer lifespan in general in any country you look at. So if you look at that angle, women probably have more strokes than men. But we don't really discriminate in that sense, how we treat them or how we manage the patient.
Well, doctors, for most of this episode, we've talked about, I've talked about healthy lifestyles and healthy choices, and you've mentioned it, Dr. Lee. What is your invitation to all of us about living a healthy lifestyle?
Well, I guess we have to learn from the experience. People who have suffered a stroke really go through a devastating life experience. Most of them will agree that having a stroke, sometimes actually they perceive that as even worse than a death.
Interesting.
So the public has to learn from the experience that it is a devastating event. It'll definitely change your life, and you have to look at it straight and learn from it. So as we discussed earlier, there are many different ways of preventing it, but you really have to change your lifestyle. Diet has to be really changed. You have to exercise and learn from these folks who have gone through the stroke.
And be more mindful, and one, as you were saying, learn more, is maybe even Google stroke survivors.
There are even literatures out there nowadays. So since we talked about diet, there are a couple of diets they recommend nowadays for stroke.
Such as?
Mediterranean diet.
Okay.
Was,
lots of greens.
Recently published, actually. It's been recommended. It's been proven.
Great.
In a large-scale study. They talked about the potassium-rich diet,
okay,
which usually means a lot of fruits and vegetables, and even the whole grain.
Okay.
So those diets are very, very helpful to prevent a stroke. So when you look at those diets, it is actually a so-called healthy diet that we know of. So it will be very useful if you learn those things.
Thank you, doctor. In regards to someone having surgery and recovery, what is your final thoughts on that?
After the surgery or recovery, it will take a long time sometimes. And the idea is that you return back to your life. Can you be able to function, be able to work, you be able to interact with the people around you? And there's a whole team, including a long-term rehabilitation program, to be able to get you back to that point. But to be able to sustain a point of recovery, will come back to what Dr. Lee said, to change your life, your style, your diet, to maintain that and remain at this point.
Dr. Bader, Dr. Lee, thank you so much. So you heard it from two of Glendale Adventist's bests. You can prevent stroke. It's May. Have the conversation with people you love about fast, face, arms, speech, and time. Time loss is brain loss. And if you are with your friends and you are sitting stagnant and doing nothing, get up, go outside, and get your exercise on. You are the captain of your ship. Do everything you can to prevent stroke. Remember, the most important conversation you're going to have is about you and your health, so why not have one right now? Gregory Zarian, thank you for joining me. I will see you next time. Take care.